One of the questions I wanted to ask is for Pradeep, how the doctor-patient relationship has changed over the last 10 years and into the future with technology and AI. I know personally for me, I have the ability to now message my doctor in a LMS type situation. Like, how do you perceive that to change over the next 10, 20 years?
Yes, that's a great question. And there's some big positives, I think, what you've discussed. There's a lot more modes of communication. When we were in COVID, we discovered the beauty of the teleconsult, right? Or the telehealth visit. And, you know, the government is stopping paying for telehealth now, which is a shame. But a lot of the private companies have actually continued payment for it. Because, I mean, think about how easy that is, right? So that's a couple of the benefits. The negative is there's some harsh realities in medicine. We're great here in Atlanta, but if you go to the rest of Georgia, they don't have healthcare coverage like we do. Not insurance coverage, but access. Huge access problem, right? I think technology can help a lot in that because if you go to South Georgia where there's no specialists, you could have a guy with one feet on the ground there, but connect with specialists in cities like Atlanta or Raleigh, Durham, or other places where you have tertiary care medical centers. So that's a positive. But I think the dynamic over the next 20 years is there's not enough doctors to cover everybody. So we're seeing the advent of the APP, which is the new word for nurse practitioners and PAs, advanced practice professionals, because you don't want to be physician's assistant because assistant has a connotation that you're not quite as good, right? And then I think AI is going to be a huge part in it, right? My daughter's in medical school. She's here at Emory. She's a third year, and I kind of advised her. I said, be a surgical subspecialist because the last thing AI will take away is your hands. What will it take away? A lot of the stuff you do when you go to your primary care doctor is algorithmically done, right? What's your blood pressure? What's your age? What's your this? You should be on this. Come back after X number of days, get these blood tests, Well, AI can do that instantaneously, right? I mean, even who watches House? Anybody remember that TV show House? Genius guy that came up with the most whatever diagnoses because he had this in his head. AI will do a House episode in about 2.5 seconds, right? You just put all the data in. This is what you got. I've researched every journal article across the planet, right, and done it. So I think that's going to be a fundamental change, and I'm hoping when that changes, we don't forget the humanity that you talked about. Because people don't just want a diagnosis, they want somebody to care for them, and those are two separate things. So I'm hoping that as we change into more of this digital world, that we don't forget the human side of things.